My name is Dr. George Ray Williams. I've been here at Opelousas General Hospital for about 14 years. I'm an orthopedist, which is a doctor that deals with the musculoskeletal system. But here specifically in our clinic, we treat mainly spine conditions of the cervical, thoracic, and lumbar region. Yes, sagittal plane imbalance is a condition where the lumbar spine normally has a nice lordotic curve just like this. But instead of being a nice lordosis where you're able to upright and walk freely with no issues, the spine starts to tip over and lean forward. What that does is when that happens, other aspects of the body has to compensate, like your hip and knees and musculoskeletal tissue, which produces pain and fatigue, and it gets worse as someone walks. They'll start out early in the morning, be able to walk upright normally, but as the day goes on, they find themselves being pitched over, leaning further over. In order to stand upright, they have to work harder to stand upright, to walk straight ahead. And when that happens, that fatigues the lower aspect of the body, producing both back and leg pain that many people succumb to with the musculoskeletal affliction of sagittal plane imbalance. The treatment for sagittal plane imbalance typically is surgical. You can try physical therapy. Physical therapy is good because it can help condition you to try to strengthen your muscles and help try to get a better posture. But the problem is it's not so much a muscle problem, it's a skeletal or a framework problem that's causing the issue. So the only way to correct that, unfortunately, is with spinal surgery. There have been many studies, prospective randomized studies out there that's looked at comparing shots, injection, bracing, and even physical therapy, but they've shown that overall surgery seems to produce the better long-term outcomes for the correction than doing those other modalities. This expected recovery time after sagittal plane reconstruction usually is several months to up to a year. It's usually several days to a week in the hospital, followed by physical therapy for rehabilitation, wearing a brace for a short period of time. But usually most people start experiencing good recovery within the first 6 to 8 weeks, up to 3 months.